you have an ovarian cyst can sometimes be a worry, especially if you're told you might need surgery. There's so many different types of ovarian cysts, and the vast majority of which are entirely benign, so they've got no potential to become cancer. And then, more rarely, there are cancerous ovarian cysts. It can be hard to know what information to trust, so I'm here to explain everything you need to know about ovarian cysts. I'm Dr Brooke, an obstetrics and gynaecology doctor, and in this video I will talk you through what ovarian cysts are, how we can tell if they are benign or more concerning, whether your cyst might need treatment, and how you might be monitored and treated for your cyst. Let's get into it. This information in this video is mainly for you if you're premenopausal, so you haven't yet gone through your menopause, and if you have been told that you've got a cyst on one or both of your ovaries. The information might be slightly different if you have been through your menopause already. So let's start with what cysts are. But before we get there, we need to know what are ovaries. Ovaries are the organs that make the hormones like estrogen, and they release an egg from a follicle, which is a small fluid-filled sac, each month. The follicle is usually about 2 to 3 centimeters when it's measured across, but sometimes they can be larger. So what is a cyst? Now, an ovarian cyst is a larger fluid-filled sac, so it's more than 3 centimeters in diameter, that develops on or in an ovary. Now, a cyst can vary in size from a few centimeters to even the size of a large melon. Now, ovarian cysts might be very thin-walled and they can only contain fluid. Those are simple cysts. Or they can be more complex and they might contain thick fluid, blood, or even solid matter. There's many different types of ovarian cysts that occur before the menopause. So some examples are a simple cyst, that's the commonest, and they're usually a large follicle that has continued to grow after the egg has been released. Simple cysts are the most common type of cysts that occur before the menopause, and most disappear within a few months. Another common type is an endometrioma. So endometriosis, which occurs where cells that are similar to those that are lining the womb are found outside the womb. This condition can cause cysts to develop on the ovaries, and they're usually filled with blood. So these types of cysts are called endometriomas. Another type is a dermoid cyst. So this develops from the cells that make eggs in the ovaries. They often contain substances such as hair and fat. Other types of cysts on the ovary are less common. Now, almost all ovarian cysts that occur before the menopause are benign, but cancer of the ovary before the menopause is rare but possible. How common are ovarian cysts? Well, they are common. Most women will be unaware that they've got a cyst, as they can cause no symptoms and they can come up and disappear spontaneously with time without you ever knowing they were there. However, up to 1 in 10 women may need surgery for an ovarian cyst at some point in their lives. So what symptoms can they cause? Well, most cysts are actually diagnosed by chance, for example, during a routine examination for something else, and therefore you might not have any symptoms at all. However, you can get some of the following symptoms from an ovarian cyst. So you can get lower abdominal pain or pelvic pain. You may experience painful periods or a change in the pattern of your periods. You might also experience pain deep inside during sex. You may have a feeling that you want to pass urine urgently and more frequently. You might experience a change in appetite or that you feel full quickly. You might also have a distended abdomen from the very enlarged cysts. Some people find out about their cysts after they've been trying to fall pregnant, and those types of cysts can also be linked to endometriosis, which can affect fertility. An ultrasound will usually be performed transvaginally, but it might also be performed across the abdomen as well. If you do appear to have a cyst, the sonographer will be looking to check that it is within the ovary. 1 in 10 suspected ovarian cysts actually involve other nearby structures, such as the fallopian tubes or the bowel. That scan can also check the size and the appearance of the cyst and look at your other ovary. If your scan suggests that you have a complex cyst, you might be offered some blood tests, and they can help to determine exactly which type of cyst it is. You don't need blood tests usually if it's just a simple cyst diagnosed. What happens next? Well, if the ovarian cyst or cysts appear to be simple and you've got no symptoms, you may not need any treatment. If you have symptoms, or if the ultrasound has shown that the cyst is complex, then you're likely to be referred to the hospital if you're not already being seen in the hospital. In the unlikely event that the tests do suggest a possibility of cancer, you'll be referred to a specific specialist gynaecological cancer specialist for further investigation. So what treatments might you be offered? Well, treatment includes watching and waiting, or an operation to remove the cyst if it's getting bigger or if it's complex. The choice, of course, is always yours, but the recommendation from your doctor may depend on your symptoms, the appearance and the size of the cyst, and the results of any blood tests. You should be given information about what your choices are in your individual situation and the risks and the benefits of each. If you do have a small simple cyst, so it's less than 5 centimeters in diameter, and you are before your menopause, normally treatment's not necessary. These cysts usually disappear on their own after a few months. You're unlikely to need a follow-up appointment. If you have a larger simple cyst that measures 5 to 7 centimeters in diameter, you'll usually be monitored with a repeat ultrasound scan about a year later. If you've got a big simple cyst that's bigger than 7 centimeters in diameter, you may be offered further tests like an MRI scan, but you'll likely be recommended to have surgery. Now, it's important to know that there's no hormonal treatment which has been shown to shrink a simple cyst once it's reached over 5 centimeters in size. So your choice is really between conservative management or surgery. Removing fluid from a simple cyst, so aspirating it, has also been shown to be of little benefit, as usually what happens is we drain the cyst and then it's likely to fill up again. Although sometimes it can be done to help us determine what type of cyst it is, or just for a quick symptom relief, but it's not usually recommended. If you've been advised to have surgery to remove your cyst, what type of operation will it be? Well, you'll usually be offered a laparoscopic or a keyhole surgery, and those should be less painful afterwards than having a laparotomy, the open surgery, and it usually means that you can leave hospital earlier and you should recover more quickly. A laparotomy or an open operation might be recommended if the cyst is very large, or rarely if there is a suspicion of cancer. I've got a separate video on my YouTube channel which explains everything you need to know about having a laparoscopy, what to bring with you, how long you might expect to stay, and what you can do to improve your recovery. So will your ovaries be removed if you have that surgery? Well, your ovaries are unlikely to be removed. The ovaries produce important hormones before your menopause, like estrogen, and therefore in most cases only the cyst is removed, a cystectomy. However, there are circumstances where the ovary may need to be removed. For example, if the cyst is very large or has even completely replaced the entire ovary, it's difficult to separate the cyst from the ovarian tissue. Sometimes the cyst may have twisted the ovary on itself, so the ovary's blood supply has been cut off, or sometimes doctors may recommend oophorectomy, removal of the ovary with the cyst from the beginning if there is a suspicion that that cyst is cancerous. It's important before going ahead with an operation to remove a cyst that you do understand there's always the possibility of oophorectomy, removal of the ovary at the time of the operation. If the bleeding is very heavy and it's difficult to stop the bleeding, it may not be possible to save your ovary. But usually this should all be explained to you before, and you should understand that the doctors would do everything they could to preserve the ovary if possible. But you need to have that discussion and have that understanding before, and usually if you're having a cyst removed from one side, from one of the ovary, the other ovary should remain intact. So even if one ovary is removed, you should usually retain the estrogen production from the other ovary if that other ovary is healthy. There's a lot more to go into than this, but your own doctor should be able to talk you through all the risks and the benefits of the operation in your specific case. So if you know that you've been told you've got an ovarian cyst and you've got any other questions that I haven't gone over in this video, let me know below and I'll continue to answer them for you.